Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices and folks that are in privatized care. We so appreciate all of their support and what they do for their communities. And every week we have people that come on here that have great perspectives and things to teach us. We have lots to learn from others. We never stop learning, never stop caring. And today we have a really awesome two special guests, which is really exciting for us. It's always a treat when we get to have more people on, the more the merrier. It's always a party here at Meddkit. Today, I want to introduce you to Stacy, Derrick, and Rayetta Michael. They are the founders of Help in the Home and Help in the Home Clinical Services. So, welcome, Stacy and Rayetta. Thank you for joining us.
Thank you for
So
having
happy
us.
to
We're
be
so
here, Rachel.
excited.
Yeah, I am too. I know we have so much to get to with both of you, but maybe we can start off a little bit about your stories. I think that's always a driver, the why. Like what got you here, and what inspired you both to open Help in the Home.
Yeah. So, Rayna and I worked together at a PRP? Is that?
Psychiatric
Yes.
residential rehab
Um,
program. Yeah.
for a few years before we started Help in the Home, we were working together, and it was 2008, and the economy was not good. And the place where we were working basically was like, we need to close a section of it. And so Rayetta actually met with the county and said, well, Rayetta met with the county. Oh, I think I'm telling the story out of order. We were trying to figure out where people could go because we were closing the 24-hour part of it.
Mm.
And it was actually a family member. This is such an important piece. It was actually a family member of one of our current clients who literally just said, can you guys do this? And so we really sat down, and Rada went to the county and she said, can we do this? And they said, yes, you can have the clients be the leaseholders. They are actually, it's not a group home. And we are providing in-home support. And that was really kind of how we started. It was this need that we saw and jumped in that way.
Mm.
Yeah. Rada, what do you, I feel like you add heart when you talk about it. Add some more.
Well, and that, so one, Stacy and I had worked together for 6 years, right? We're just an
Yeah.
incredible, we're good partners, right?
Mhm,
We're each married, but we call each other our other life partners, right?
mhm.
And that was 22 years ago. And so we had worked together for 6 years, and we're always looking at what more is needed, right?
Mm.
So in the mental health system, at least in the state of Maryland, the psychiatric residential rehabs would provide a certain amount of support a day. And it was really hard to get 24/7 support and really hard to get really good quality in-home care support once someone had moved out of
Sure.
that structure, right? And so when we needed to find care for people, it was the 24/7.
Sure.
And the county, because I was the one, we were tasked with finding placement for 9 individuals, and we could only find placement for 5 of the 9. And I worked with the county to do that. And they were the ones that said, yes, you can, right? Like and basically we became an in-home care agency that provides mental health support. And we can do 24/7 in our residential community. And we can do 2 drop-ins a month, right? For people that are living and working throughout the DC area or living and just enjoying life throughout the DC area.
Sure.
So,
Yeah. No, I mean, I am always interested in, how people got together, why they started something. I think there's always the power in partnership, when you find someone that you are aligned with and that you feel great about working with. There's so much impact that you can have together, on your community, and it's so great that for so many years that you have joined forces. In your previous role, but also in what you're doing today, and with your joined forces, I'd love to hear a little bit more about how you both are helping the community that you guys are serving, and maybe how things maybe typically work in supportive living communities, and maybe you can share a success story with us, and what that give us a view of what that really looks like for people.
So
Yeah.
I'd like to start with our supported living community and talking about the residential program,
Hmm.
right? So in the when someone has a complex or severe mental illness,
Hmm.
um, there's hospitalization,
Hmm.
there's residential treatment programs,
Hmm.
and there's not a lot of support for when you step out of the hospitalization or the residential treatment, right?
Hmm.
And we know all the research and evidence-based practices are community is so important,
Hmm.
long-term support is so
Yeah.
important for successful recovery.
Hmm.
And that's just a gap in our system. So, what we're doing really is meeting the need by having a private residential community that's not a group home. It's not an assisted living.
Hmm.
These are the clients' names on the leases,
Hmm.
and we're providing in-home support to them. And
Hmm.
it's 24/7.
That's
So
amazing.
we're monitoring medications. We're seeing that, we're supporting them to see that they have good nutrition, that they like their activities during the day.
Hmm.
And what I think is so amazing and why Stacy and I talked about the two different stories we wanted to share
Hmm.
is how we meet people where they are in vastly different needs.
Hmm.
But it all comes back to that core of being valued
Hmm.
and being a part of community. So one young man that we served graduated. He was diagnosed with schizophrenia while he was in college and getting his bachelor's in graphic design.
Hmm.
And he was able to get on the right meds and get the support that he needed. And he finished and he graduated from college. And he was really good at interviewing. And he got two jobs in succession
Hmm.
and lost them. One within 2 weeks, and he was hospitalized. The other one within a month, and he was hospitalized. And his psychiatrist who knew about us said, "Why don't you go stay in their residential community until you figure out what's needed for you to be able to maintain employment?"
Hmm.
And he did. Within 3 weeks, he was employed full time with a graphic design firm that was within 5 minutes of where we are in downtown Rockville. And within a couple of weeks after that, we were able to identify what his struggles were.
Hmm.
And it was knowing and learning how to fit in socially in this new setting and manage those stressors without turning to substances.
That's that's
And
amazing. That's
yeah, and how do you fit in at happy hour and not overdo it, right?
Yeah, there's a lot of so many things to consider. When you're putting someone back into the world and I love that example that you gave and maybe Stacy, there's another that you're thinking of too. But it's amazing where people have been and it's amazing where you're getting them to. And I think, these
Well,
things don't discriminate,
and to pull that around
happening to
full
anyone.
circle
Hmm.
with their support, where his care coordinator would go and meet him for lunch where he was working
Hmm.
and do that, he kept that job for more than a year and then decided to go back. And he moved out to his own place, and we still supported him. And
Hmm.
then he went back to graduate school in graphic design. So we served him for over 3 years through that journey,
Hmm.
success after success after success, because we could see what was going on 24/7 and provide him the supports that he needed. Does that?
Yeah,
Yeah.
that's
And then
awesome.
Stacy can tell us about someone with very different needs.
So yeah, so this other client, he actually, we first got contacted with him when he was living at, I think it was Pasadena Villa in
Mm-hmm.
Tennessee. He went
Mm-hmm.
there and he was doing really well when it was a really small program. As
Sure.
there got to be more people there, it just was no longer the right fit. And so we actually started working with him virtually before he came here. And he was very clear. He's someone who is on the autism spectrum. He has psychotic disorder, and he was very clear. He's been in sort of residential schools and residential programs his whole life. He's a young guy in his early 20s, and he was basically like, I I don't want to socialize. I don't want to make friends.
Yep.
I want to live a small life, and I want to ride the metro.
Yep.
And we were like, great. great. Okay. And so I actually connected with a behavior therapist. And I still, I mean, this has been years at this point in time. And I remember I
Mm.
sat down with him. I was like, great. So here's the thing, I need a behavior plan that can't look like a behavior plan or sound like a behavior plan. And it can't talk about socialization or friendship or kind of any of these trigger words. And
Yeah.
what's important to him is he eventually wanted to learn how to ride the metro.
Mm.
He, at this point in time, wasn't able to walk down the street without an aid because he would actually just be really inappropriate. He would be cursing at people, yelling at people,
Mhm.
and he just wanted to get on the metro. And
Yeah.
so we created a metro safety plan.
Mm.
That was the plan that we worked with him through of, well, before you can get on the metro, you have to be able to cross the street without yelling at people.
Yeah.
Well, no, you have to be able to ride in a car without trying to jump out of the car to get to the
Yeah.
metro station.
Yeah.
And I remember a conversation I had with him where he was really like, listen, I understand that you're saying that society says I can't do this, but I don't really care what society is saying. I want to do it anyway. And I was like, look, I understand what you're saying, but this is really a safety issue. It's not safe for you to
Yeah.
do these things. And so while the piece of like, this is the general norm didn't matter to him at all, he
Mhm.
really was able to understand the safety.
Yeah.
Um, and he's amazing. He's actually, I think this was what, 6 years ago, Rayetta?
Mm-hmm.
And he is
Yep.
still living in our supported living community. He has made friends. He takes classes at Montgomery College. He does not have an aide. He actually does not need an aide at all. Is just really supported in our supported living community, and is like literally a rock star. He like had a realization a few years in that he could be friends with people. I mean, I remember him being like, "Wait, the person who lives next to me goes out to dinner with their roommates. Can I do that?" Yes, you can do that. And so he is like the rock star of our community. He makes dinner like once a month. He'll actually make dinner for the whole community. He's gone on vacations with his mom to visit his grandma, which they never, I mean, it's really been this, I don't know, amazing
Transformation, really amazing
transformation. And
transformation to adulthood.
truly,
Mhm.
like Rita's saying, it's like we really saw him and we're saying, like, how do we connect with you where you are? And how do we make this make sense so that you can grow really how you want to grow? The pieces that maybe are important for other people might not be important for you, and that's okay.
Yeah. It seems like how your approach, which kind of leads me into maybe my next segment, is it seems like your superpowers are really what you said is meeting people with where they're at and maybe doing some things that seem maybe unconventional to the outside world, but really makes sense for that person to get them. It seems like you've been really able to meet people where they are, and do something that may be a little bit different from what other people might recommend, but know that it's the right path for that person and you're getting them to their goals and beyond. Would you say that's accurate in terms of, how you go and approach things and what makes your approach kind of a little bit unique as to
Well
other
said.
places?
Yeah, no, I
Well
right. I
said.
actually,
Mhm.
yes, I feel like that's the best summary I've heard about what we do.
Oh,
Thank you.
good.
Thank you so
Yeah.
much.
Yeah, no, I
Yeah.
mean, in all of this, I'm always interested in hearing about what makes, others unique. And I think as, people that are in healthcare, whether you're a private practice in community health, mental health, behavioral health, all of the above, I think there's something unique that we all bring to the table, and why an approach works for one person or another. And I think you guys really nailed down your community in that, you're really focused on the individual. You're focused on the care, but really tailoring that, to where that person is, no matter what level they're at. So I think that's pretty neat, that you've been able to do that, and especially get your fellow there, and not only in a good safety protocol, but got him to his goals and beyond. Didn't even think he would probably be doing some of the things that he's doing today.
Yeah.
Really cool.
Well, to see him really enjoying connecting and being friends with other people, I
Yes.
mean, that's
He
it,
didn't even want that.
He
That's
didn't want
amazing.
it,
He
Yeah.
right?
did
And we
want
didn't
it.
say, "Oh, you have to do this."
Yeah.
But it grew into that when he saw how other people cared for him and he wasn't being forced into things.
Yeah.
Right.
He really, and
Well,
that was from the clients too.
yes.
Like we're bringing very different people together in the residential community, but
Sure.
he was able to see how someone who works full time and is his roommate, would bring him home French fries, and things like, just like
Yeah.
people care about him. And
Yes.
so he wanted to start showing up, and that was really cool. So,
Well,
yeah.
and that's it. The way that you described what we're doing is so interesting because it's really why we started helping the home clinical services. I
Mhm.
mean, it really was, during COVID specifically, when everything went virtual, virtual just wasn't landing for our clients. And so, in that vein of how are we meeting people where they are, for a lot of our people, they literally needed someone to go to them.
Yeah.
If you're having a really hard time and the onus is then on you to get yourself to your therapist, to get yourself to your psychiatric nurse practitioner. And
Yeah.
for our clients, that just wasn't working. And so that really was the whole reason we started helping the home clinical services, was because we really were like, wait, again, we need to get to people. Maybe we're having therapy sitting in someone's living room. Maybe we're taking a walk. Just how are we getting to people and connecting with them in the way that they can?
Yeah, I think people don't talk enough about accessibility
Yeah.
and I think that can be different in different areas and maybe you can speak to this. I feel like every specialty and our wonderful ecosystem of healthcare um, is always plagued by some kind of like misconception. Everyone deals with them. I'm sure you get questions all the time. Well, I heard from a friend that programs like this are like this, and
Right.
you're in this bucket. You can't get out of whatever box
Mhm.
someone put around you, which I think is hard for people that are doing things that are different. And then you have Google and ChatGPT and WebMD telling you a whole bunch of other things as well. And so, how do you both deal with the questions of like, where did you read that? Not true. I want to debunk this. So maybe for like everyone listening, for like once and for all, like what are some of your maybe like most frequent questions that you get asked or misconceptions that people have about what you do?
So I think the biggest misconceptions about mental health in general and
Hmm.
schizophrenia in general is that once someone has that diagnosis, there's no hope.
Mm.
And it's the scariest diagnosis to get, that the treatment system is broken
Yeah.
because it doesn't provide the supports that are needed for the long-term recovery. But we know what works, and there are medications that will stabilize the disease progression and help the brain heal and rewire those neural pathways. And we know that the core pieces for that are community. Staying on the right, first finding the right meds, finding the right providers, finding the right people that can
Hmm.
walk this journey with you. And it's a long one, right? And it can
Yeah.
be a hard one, but to walk that journey, keep holding on to hope, and people can really enjoy life and thrive. It may not look like what holding a 9 to 5 job and earning enough income, it may look like being on this, it might be that, we've
Hmm.
worked with lawyers, we've worked with other mental health professionals, we've worked with
Hmm.
engineers that are doing just that with the diagnosis of schizophrenia,
Hmm.
right? But we also work with people that are on disability and
Hmm.
they're volunteering and they're giving back to the community in other ways, and enjoying life. And that's really what recovery is. So, does that?
Yeah, that's really wise. I think everyone's, like you said, like everyone's journey is different and everyone and their capability too, can be different. And then it's amazing, like we said, like you come in with one goal and then you've exceeded them. And so I think yes, I can understand where people get the misconception that, even if whether it's a diagnosis, any type of diagnosis, whether you have cancer or this, some people feel like, oh
Right.
my gosh, there is no path forward.
Mhm.
It just means that your path might look different. And I love, and it's different from each individual. And I think just normalizing that. And I think everyone's used to the Amazon 2 day shipping. That's what we have is 2 day shipping.
Right.
Right.
you
Right.
know?
Or take the pill and everything's better, right?
Right,
Like,
Right.
right.
Yep. Or we get
Well,
this treatment and it's not that. It's different.
and it's interesting too, because I also think one of the other, I think, sort of things that are difficult is about the funding of this. So insurance does not cover what we do
Yeah.
because they, and we've had many conversations with insurance carriers because they really call it like maintenance care. And that I actually think is another thing that's difficult too, because it sounds like it's something extra or something not needed because
Hmm.
it's not that take a pill and you're fine, but it really is it like Rita's saying, it's the foundation. I mean, it's the foundation to recovery and long-term stability. And I feel like until we sort of are able to figure that piece out as a country, really, like that's a people are paying for it privately because it's very needed, and there's this huge disconnect with what insurance will cover.
Yeah, it's crazy. You can argue that it's preventative. Like if
Yes,
think
it is
Very
absolutely.
right?
much so. Very much so.
And you could argue that if we did some of the basic things for our health, like if you think about it from that perspective, like this is the basic things that this person needs to live
Right.
a healthy and sustainable life and to be, you know, a good functioning member of their community. And so that's at a basic level,
Hmm.
right?
Yeah.
And
Yeah,
so yeah, it's so interesting, like from everyone and their experiences, and no matter what specialty they're in, how much insurance and comes into play, and what they can do, what they can't do, what we have to pay outside of that, to get the necessary services that we need, to be the best that we can be.
Hmm.
It's important to talk about these things too, because I think it is a great misconception as well. And insurance, man, we could have a whole segment on
Yes.
insurance. Um,
Yeah.
it's wild, but I really appreciate you both bringing that up because it's just such an important thing for people to know, as they're exploring services, they're exploring the right things for them, getting into a unique community like this, and what that looks like and why it's needed, and for the insurance companies that could be listening. Hope
yeah.
you're watching.
Absolutely.
Yeah,
Yeah,
it's important. But just to, round everything out today for, people that are seeking the support, whether, it's families and sure to maybe how to help a loved one, um, or anyone that's in the caretaking position. Like, what are some of the things that maybe you recommend as a good first step, and maybe for other providers too. Let's not forget them. They're also a great referral source. They might be seeing someone, that can refer people to you. What are some of maybe the services, that you can work together on? What are things that help, working together transform, one of your clients or patients' lives?
absolutely. Really, the psychiatrists and therapists, we're able to help them
Hmm.
serve a broader network of clients,
Hmm.
right? So, like the young man whose psychiatrist said, go live in the supported living community, he
Yeah.
continued seeing a psychiatrist through
Hmm.
all of that, right? It's not going away to a treatment program. We
Right.
were right there in the community, and he was living life with his treatment provider, long-term treatment provider. So we really want to get to know the treatment providers in our area so they can use us as a resource when their clients are needing something more than what they can offer with therapy once or twice a week, that type of thing. And we can go in the home, we can see things that
Yeah.
you just don't see in the therapy session. And so, yeah, I'm really glad you brought that up. Even though we have help in the home clinical services,
Hmm.
that's to meet the needs for people who can't get out and go to their own
Yeah.
therapists. It's a niche, but we really are great at teaming and
Yeah, I
partnering,
was
and
gonna say
that's
that was the thing is teaming, like that specifically, that is one of our foundational pieces is it doesn't have to be just inside of help in the home and help in the home clinical services. Like whoever the client is, everyone who's involved is a valuable part of that team. And really, what can we do to support the entire team? Because that's it too, is sometimes it's going to be the client, but really then there's also the client's family. There's like, how do we sort of look at the entire situation and provide support so people aren't in it on their own.
Yeah.
And and that kind of what's the golden nugget for all of this, who are in it? I think it's self-care. We're talking to the clients about self-care. We're talking to ourselves about self-care. Stacy and I talk every morning to do a gratitude practice,
Hmm.
where it's meaningful with our staff, to practice
Hmm.
gratitude and self-care. And one of it's called Center for Motivation and Change
Hmm.
has a great book, How Science and Kindness Support Healing. And the foundation in it is self-care. And then how do we, once we found our own ability to like be calm and peaceful, how can we reach out with kindness in really difficult situations and hold it, hang in there through difficult situations. So I'll recommend that book, this piece about holding on to hope, right?
Yeah.
And there's another book that I just learned this year. It's called Awakenings by Bethany Yiser. She is an
She's
incredible young
awesome.
woman who started the Cures Foundation. She has schizophrenia and was homeless and refusing care for a number of years. And she tells the story of her life and then how once she got on the right medication, got the right supports, she has started a foundation. She's a public speaker. She plays a concert violinist.
Hmm.
And now she's collected stories of hope from so many different people. And that's what the Awakenings is people who have have come through that same or similar paths and are living lives that are good and enjoying recovery.
That's so awesome. I thank you for the resources. I think it's always great when people can go out and read something or educate themselves further on, what their passion is, what they're doing in their everyday. I think, a part of Provider Spotlight and all of this is to learn more, is to understand different perspectives, to go about your day and incorporate maybe something that you've heard from here in the past, 20 to 30 minutes that, oh yeah, like that is a really good idea. That's really smart. I didn't think about serving my patient or client in this way before hearing this. And that's really awesome. So I'm going to do that. So I think in all to be said, I really appreciate, both of what you had brought here today to share your stories, to share your clients' stories, and how you've made them successful in your communities and beyond. And before we leave off today, I'd love if you wouldn't mind, sharing where folks can find you, where they can reach out, where they can get more amazing resources from you both, because you're both fantastic and amazing and have done so much for your community. And we'd love to see that move forward.
Yeah, absolutely. I mean, we have a website, helpinthehomellc.com is a good way to start. We're on LinkedIn, Facebook, Instagram. Um, yeah, I think those are all the different ways. And really we want people reaching out. Like we are not going to be the right fit for every client,
Sure.
but we can help guide to where a good fit might be. Like we really do, like you said, want to be a resource. That's really important.
So yeah, feel free to just call for a free
Yeah.
consultation. Mhm.
Yeah.
I love it. Well, thank you so much, Stacy and Rayetta. We appreciate all of your knowledge and how much you've done for your community, and we hope to have you on again very soon.
Thank you so much for having us.
Anytime. Thanks, ladies.